Marsha Blackburn is a pile of largely untraceable super PAC cash that gained sentience in 2003 and is now currently a Republican senator from Tennessee. Nowadays, she is best known for being part of Trump's presidential transition team, utilizing rhetoric found in fascist terrorist manifestos, being dissed by Taylor Swift, and pushing a ludicrous conspiracy theory so fraudulent that the people who promulgated it literally got indicted. It's that last thing I really want to get into. Circa 2015, an organization called Center for Medical Progress posed as a biotechnology firm and held meetings with personnel at Planned Parenthood, which they secretly filmed. CMP claims that this sting operation of theirs uncovered proof that Planned Parenthood, a non-profit organization, was profiteering off the sale of fetal tissue. This triggered multiple investigations at the state and federal level. As a result, Planned Parenthood was cleared of any wrongdoing. The founder and one member of CMP was indicted on multiple felonies in multiple states. A crazed terrorist attacked a clinic and killed 3 people. Planned Parenthood was defunded in multiple states. And fetal tissue became much harder to study, stalling out research into Alzheimer's, ALS, the Zika virus, infant and childhood leukemia, spinal cord injuries, and HIV. Sitting at the head of this firestorm? One Representative Marsha Blackburn, head of the Special Select Committee on Infant Lives, which is the only reason this video is about her. It could have been about any number of pro-life politicians. Blackburn is pro-war, receiving a towering 3% score from Peace Action West. She is anti-environment, receiving a lifetime score of 2% from the League of Conservation Voters. She opposed the Violence Against Women Act specifically because it included LGBTQ provisions, and as mentioned, she deals in white nationalist rhetoric. How does she square her desire to bomb the entire Middle East and her drive to melt the polar ice caps with being pro-life? How does she square her contempt for LGBT people, immigrants, and racial minorities with her pro-life arguments? Well, if you want to find out, then keep on watching. The history of abortion restrictions. I'm not going to get too much into the philosophy of abortion debates. It's not uninteresting, but PhilosophyTube already did a haunting video on this with strong production values and powerful horror undertones. I want to talk about the evidence on the table because the most moral path will always be an actualizable path. It doesn't matter how badly we might want something if we can't physically achieve it. The most frequently cited evidence from the pro-choice crowd is a prolifically cited Gutmasher paper that finds, quote, abortion rates are no lower overall in areas where abortion is generally restricted by law and where many abortions are performed under unsafe conditions than in areas where abortion is legally permitted, end quote. In their 2004 paper, Abortion Policy and Fertility Outcomes, the Eastern European Experience, Philip P. Levine and Douglas Steger find more complicated results. Quote, restrictive abortion laws in which abortion is available only to save the mother's life or for other specific medical reasons increase the birth rate by 9 to 17% relative to that in a regime where abortion is available on request. This finding is statistically significant in the model without country-specific trends, but with these trends, imprecision in the estimate would lead us to fail to reject the null hypothesis despite a very large point estimate, end quote. With regards to maternal death, they find, quote, in the model without country-specific trends, estimates indicate that the relative female death rate is 10% higher in countries where abortion is available only to save a mother's life or for other specific medical reasons, compared with countries in which abortion is available on request. The introduction of country-specific trends, however, lowers this estimate and increases its standard error to the point where it is no longer statistically significant, end quote. Severe abortion restrictions lead to a significant drop in the pregnancy rate. Quote, with the use of all available abortion data, estimates indicate that pregnancy rates fall by 27 to 45% when abortion moves from available on request to available only in serious medical circumstances. This estimate may be inaccurate, however, in that it fails to include counts of pregnancies that result in illegal abortions when restrictions are severe, end quote. Countries where abortion access is more liberalized do have more pregnancies result in abortions, but this is hard to extrapolate from. When abortion is heavily restricted, people invest more in preventative contraception, which is likely why the rate is so consistent irrespective of the regime. Levine and Steger find little long-term impact on light restrictions, even a falling birth rate. Though, it's important to note that light restrictions can have a big short-term impact if they are unexpected or sudden. Quote, one important exception in this literature is Philip Cook et al., who find that unexpected short-term limitations of Medicaid abortion funding in North Carolina were associated with a decline in abortions, a rise in birth, and little change in pregnancies. However, unlike other studies of Medicaid funding, the reductions in Medicaid funding in North Carolina were a surprise because of end-of-year budget shortfalls and, therefore, unexpected at the time time that women became pregnant. Thus, the North Carolina results emphasize the importance of the pregnancy decision in determining the impact of abortion availability on birth rates. End quote. The nature of clandestine abortions is that they are clandestine. Reporting accurately on them is difficult, but one thing is clear. When abortion is heavily restricted, people who do not wish to carry a pregnancy are forced to do so. People who would not otherwise have been born are born, and people who would otherwise have lived die. Quote, for instance, in Texas, the rate of maternal deaths rose from 72 deaths per 100,000 live births in 2010 to 148 deaths per 100,000 live births in 2012. As for the doctored baby body parts profits videos, they kicked off not just terror attacks, but also witch hunts. Quote, congressional inquiry seeks the names and identities of academics, including graduate students, prompting criticism from scholars who say that the probe is more about intimidation than information, end quote. This naturally threw a spanner in the works of scientific research. Quote, Larry Goldstein, scientific director of the Sanford Consortium of Regenerative Medicine in San Diego, for example, told Blackburn's committee at its first hearing earlier this month that a project to cure multiple sclerosis had been halted because it had basically seen supply of fetal material dry up completely, according to the Times. End quote. Dr. Eugene Gu, part of research group Ganogen, is developing a procedure to take organs from aborted human fetuses and grow them in lab animals, with the ultimate goal of transplanting them into humans. He's published research to show it's possible. Quote, these are organs that would normally be thrown in the trash can, Gu said, end quote. On the state level, quote, legislatures have moved to crack down on research on fetal tissue. Florida recently passed a bill prohibiting efforts to sell or donate tissue from aborted fetuses, and at least 5 states, Indiana, North Dakota, Ohio, Oklahoma, and South Dakota, prohibit fetal tissue research outright, according to the National Conference of State Legislatures. End quote. It's not that I don't see the ethical quandary here. Consider stories like My Sister's Keeper, wherein a couple finds out their daughter has a rare cancer, so they have another kid to act as a marrow donor. Or sci-fi like The Island, where the super wealthy get ultra gold-plated health insurance policies that guarantee them perfect donor matches that turn out to be based on clones of themselves, raised in isolation. The thing is, though, we already have this ethical quandary. Organ transplants already exist. We have standards and institutions and laws in place for that. We can do it for fetal tissue too. If you want to apply a level of moral or religious sanctity to fetal tissue or cadavers, go ahead and make that case, but be honest about it. Research coming out of these fields, as well as donor organs, have saved millions of lives. If you want to end that just to force people to carry pregnancies to term, that's on you. As an aside, if you force someone to carry a current pregnancy to term, you're altering the odds with respect to any future pregnancies, which also risks the lives of the unborn. But I promised we wouldn't be getting into philosophy here. Things that actually reduce abortion rate. The Tea Party wave of 2010 swept into being the greatest spate of abortion restrictions ever recorded, greater even than the half-decade directly after the Roe v. Wade decision. Even so, quote, the Lancet did not observe an association between the abortion rates for 2010 through 2014 and the grounds under which abortion is legally allowed, end quote. So, what does reduce abortions? Well, comprehensive sex ed does. It's well known that abstinence-only sex ed states have the highest rates of teen pregnancy, something California learned the hard way. Quote, in 1992, the state's teen pregnancy rate was 157 per thousand teens aged 15 to 19, the highest rate in the nation. To combat the problem, the state launched a 3-year abstinence-only sex education effort, only to cancel the program in 1995 when it had absolutely no effect on teens' decisions to start having sex, end quote. In 2003, the state passed comprehensive secular sex ed. The result? Quote, by 2005, California's teen pregnancy rate was 75 per thousand teens, a more than 50% decline that dwarfed the corresponding national decline of 37%, end quote. Teen abortion rates followed a similar trajectory, falling to 1/3 their previous level over the same time period. Another wildly effective policy is to just give people birth control for free. Counterintuitive, I know. Quote, the state of Colorado has also found this to be true. After handing out free IUDs and implants to teens and poor women over 6 years, the statewide teen birth rate dropped 40% from 2009 to 2013, while the abortion rate dropped 42%. End quote. Indeed, long-acting reversible contraceptives reduce abortion among adolescents by about 75%. People who oppose these programs aren't doing it to be frugal either. Quote, every dollar invested in contraception can save between $4 and $17 down the road in healthcare costs. End quote. Put a pin in this one though. We'll return to it. Avoiding recessions is also a good call, unsurprisingly. Quote, ecological regression models showed that rates of induced abortion tended to increase between the two pre-crisis periods, but remained stable between the second pre-crisis period and the crisis period. In addition, we observed socioeconomic inequalities in induced abortion in both cities and in all age groups, and that these inequalities persisted across the 3 study periods. End quote. A lot of this makes sense when you consider why people seek abortions in the first place. Quote, having a baby would dramatically interfere with their education, work, or ability to care for their dependents, or they could not afford a baby at the time. In addition, qualitative data from in-depth interviews portrayed women who had had an abortion as typically feeling that they had no other choice, given their limited resources and existing responsibilities to others. End quote. It's not surprising, then, that 42% of women who seek abortions live below the federal poverty line, and that programs centered around healthcare, childcare, education, and maternity leave all have big impacts on the decision to abort or carry a pregnancy to term. Quote, the New England Journal of Medicine shows universal healthcare programs lead to decreases in abortion rates, despite the services being free and accessible under these regimes. End quote. Massachusetts managed to reduce its abortion rate under Romney Care by about 17%. For comparison, Texas used targeted restriction of abortion provider laws in 2013 to shut down almost half of its abortion clinics. Liza Fuentes found this reduced the overall short-term abortion rate by 13%. As people adjust to those laws, though, the impact may diminish. I could go on and on here. The point is that empowering working people, especially women, lowers abortion rates more reliably than authoritarian measures. So one of the things that was confusing me as I listened back to this was the idea that in liberalized regimes, a larger percentage of pregnancies ended in abortion, but that the rate of abortion was still the same. So I'm going to quote to you from an article here by Diana Green Foster. Quote, so why do advocates keep saying that women are able to get their abortions even if abortion is restricted or illegal? The evidence comes from comparisons of country-level estimates of abortion rates in countries with legal abortion and countries where it is illegal under all circumstances. The average number of abortions is roughly the same in these two sets of countries, 34 and 37 per 1,000 women, respectively. Note that what I just said is the number of abortions per woman, not the number of abortions per pregnancy. Continuing on. But what is not the same is the demand for abortion. The unintended pregnancy rate is significantly higher in countries where abortion is illegal, probably because contraceptives are also difficult to access there. That only 48% of unintended pregnancies are aborted in countries where abortion is illegal, compared to 69% where it is legal, indicates that many women have to carry unwanted pregnancies to term. End quote. And again, as I mentioned, people are more likely to keep track of their contraception if they know that it's very difficult to get abortions, but, and there are cultural differences, but those are the facts, and I wanted you to have the facts. The Desert Island and the Pantry Cannibal. In 1972, a passenger plane crashed in the Andes Mountains. Quote, of the 40 passengers and 5 crew who took off on the fateful Uruguay flight to Chile, only 16 survived after the plane crash, an avalanche, and hypothermia. Those who did make it back to humanity after an epic 10-day hike for help by Nando Parada and Roberto Canessa survived for the most part on a combination of miracle-style mental toughness, group endeavor, and desperate cannibalism. End quote. Cannibalism is a serious taboo, but in this instance, I doubt many people would judge the survivors for what they did. Compare this to, say, Jeffrey Dahmer, or perhaps a more extreme hypothetical. Consider accidentally locking someone in a fully stocked pantry for like 20 minutes, only to open the door to find they've already killed their friend and tucked in. Those fighting to make abortion illegal want to be seen as, at worst, the desert island survivor. Sure, they may be engaging in militant sexual violence against women on a mass scale, but it's to save lives. That's not what they are, though. They're not the survivalist. They're the pantry cannibal. Does Senator Blackburn support maternity leave? No. Universal health care? No. She even voted to repeal Obamacare fully 1,000,000 times, despite the abortion reduction associated with Romneycare. She's got a 100% record from the Christian Coalition. Does the religious right support free contraceptives or comprehensive sex ed? Of course not. She voted against raising the minimum wage to $7.25 and has a 0% rating from the AFL-CIO. So don't expect her economic policies to help the financial issues driving people into unintended pregnancies and abortion. But let's get outside the realm of kitchen table issues and even abortion. The number of people who die every year from hunger is over 7 million. Lack of clean water, over 8 million. The number of maternal deaths per annum is over 3 million. Does the far right even have a plan to end world hunger? Even just using the food we already throw out could do it. No, of course not. Do you all remember the harvest box? No, it's a thing. Without intervention, hundreds of millions of people will be displaced by climate change, and Senator Blackburn is deep in the tank for oil and gas. In every single conceivable way that exists to save and improve lives, the far right is opposed. Unless they get to be authoritarians, I guess. They won't protect you from old age, cancer, or discrimination, because they can't blow anyone up doing it. These folks seem to think that a billionaire trust fund baby has more of a right to their tax havens than a working woman has to her own body. And Blackburn is a fan of tax havens. You'll never find anything approaching meaningful self-sacrifice within the politics of the reactionary. This isn't about giving something to save the unborn. It's about reactionaries getting something. Here, putting women in their place through sexual terror. Now, I don't think we can get any deeper than this with regards to reactionaries, and that's what Senator Blackburn is, at best. These are not empathetic or well-balanced individuals. You can talk about a century-long climate depression killing tens of millions of people, at a minimum, and they'll get on TV and whine about wanting a limitless supply of hamburgers. They will kill you for treats, like all bootlickers. What I want to get at here is the synthesis that takes place between these bigots and their billionaire donors. And make no mistake, these are misogynists either way. Motherhood as free labor. I've written about this before in my essay on gender studies, but every economic model, from slavery to serfdom to capitalism, is essentially built on top of the domestic economy. Once the ruling class has expanded its reach as far as possible, the only way to get new subjects is through the sexual exploitation of lower-class women. Quote, the price tag, in today's dollars, for a baby born in 2015, about $233,610 from birth through age 17 for a middle-income family, and about $372,210 for a family in the highest income bracket, says the U.S. Department of Agriculture. And guess what? That doesn't include college. For a 4-year public school, you'd need to add $83,080 to the total bill, $187,800 for a private school, according to the College Board. End quote. That's not all, though. It's necessary to take into account the actual sexual labor, not just the day-to-day reproductive labor. The market rate of surrogacy is about $100,000, sometimes more. Working-class Americans create millions more in value in their lifetime than they consume. In the past, this would accumulate to the tribe or on the family farm. Nowadays, it accumulates in the hands of capitalists cashing dividends checks. What's the result of all this? Well, women need more flexibility in their jobs to become mothers. That's just the nature of pregnancy. They're likely to also need time off as a result of giving birth. By the time the kids come along, a mother likely now makes less money than her presumed male partner, who didn't need the flexibility or the time off. So now that she's making less money, whenever someone needs to take time off to tend to family affairs, who is going to take the time off? Well, likely whomever makes less money, especially nowadays when most people live paycheck to paycheck. Women spend about 2/3 of their labor in the unpaid domestic sphere. For men, it's the opposite. They spend 2/3 of their labor in the paid productive sphere. Quote, as the women's share of the workforce rises, their wage rate as a percentage of men's wages rises. In fact, the correlation between the two series is 90.9%. That means that only 9.1% of the change in the wage gap needs to be explained by other factors. For instance, union membership. End quote. There's your wage gap. This is the billionaire interest and anti-choice movements. They get more free labor in the domestic sphere and more impoverished, desperate workers to exploit in the productive sphere. Quote, States that are hostile to abortion have 4 or more abortion restrictions, have a worse wage gap than states that aren't hostile. In states that are not hostile to abortion, women, on average, make 20 cents less for every $1 a man makes. But in hostile states, women make 23 cents less for every $1 a man makes. End quote. In her 2006 paper, More Power to the Pill, The Impact of Contraceptive Freedom on Women's Life Cycle Labor Supply, Martha J. Bailey found that, quote, cohorts with earlier legal access to the pill had fewer births before age 21 and worked more for pay during their late 20s and early 30s, end quote. Anna Bernstein and Kelly Jones of the Institute for Women's Policy Research concur, noting that, quote, effects were stronger for Black women, increasing labor force participation by 6.9 percentage points, compared with 2 percentage points among all women, end quote. Marxist economics professor Paul Cockshott writes, quote, basically there are 3 ways that women's workload in the home can be reduced. 1. A larger share of housework has to be done by men. 2. The productivity of labor in these tasks has to rise. 3. The same tasks have to move out of the domestic economy, end quote. Does anyone think people like Senator Blackburn are going to sponsor the resocialization of men, or give out super Roombas to cut down on housework, or start sponsoring public dining halls, public laundries, and free public childcare? Didn't think so. Cockshott uses 2011 data from Statistics Canada to figure out the difference between the exploitation of men and women. Total wages paid, $766 billion. Surplus produced, $497 billion, for a rate of exploitation of 0.65. But the rate of exploitation measures the extent to which someone's labor is unpaid by comparing productive versus reproductive labor, as well as the wage differential. Cockshott calculates that for men, the rate of exploitation is 0.55, but for women, it's 0.77. Anti-choice movements are a necessary aspect of maintaining the double exploitation of working-class women, first as workers and again as women. Conclusion. When the people who refer to immigrants as invaders and an infestation tell you they think a fertilized egg is a person, it should mean absolutely nothing to you. When people who drop bombs on children or put them in cramped cages so underaccommodated that they die tell you they think a fertilized egg is a child, it should mean absolutely nothing to you. I think that discussing the philosophical divide with regards to abortion is important, but I think it's also vital to recognize that the right does not believe what they claim they do. They are not motivated by what they claim motivates them. When you accept these claims of theirs, you're not just steel-manning their arguments, you're fighting a decoy. Only a historical material analysis can reveal what these reactionaries are really about. Truly saving a life is about bringing someone to a state where they can be a healthy part of society, and that requires work, or at least tax dollars. I'll believe that reactionaries think of fertilized eggs as people once they start criticizing fertilized eggs for demanding placental handouts. We all know how they feel about people who can't afford healthcare.
Idea that you have to prepare and take care of everybody.
But Congressman, are you saying that society should just let him die?
No.
I would hit them, Brian, so hard like they've never been hit.
What about civilian casualties? What about the fact that we're targeting them and people are very concerned about collateral damage?
I would do my best, absolute best, but we're fighting a very politically correct war.
Yeah. Well, we see that
and the
happening
other
in
thing
Vermont.
is with the terrorists, you have to take out their families. When you get these terrorists, you have to take out their families. They care about their lives. Don't kid yourself.
Fox's Laura Ingraham compared the detention centers to summer camps.
More kids are being separated from their parents and temporarily housed in what are essentially summer camps.
While all the chaos and violence is going on in Israel right now, we also have the official opening of the new embassy, the U.S. Embassy in Jerusalem. And Donald Trump has chosen Pastor Robert Jeffress to give the opening prayer. Robert Jeffress is a complicated figure, and he is a particularly bad guy for this particular event, and that's not a coincidence. Now, I want to give you a little bit of background on him. When this graphic comes up, it's going to look wordy. This is very much the cut down version of it, by the way, so I apologize. He's a guy with a long history, and much of it deserves to be covered in this context. Pastor Robert Jeffress runs the First Baptist Dallas megachurch in Texas, has referred to both Islam and Mormonism as, quote, a heresy from the pit of hell. He believes Islam, Mormonism, Hinduism, and Buddhism are all cults. He could expand that list, I guess, and that Catholicism represents the genius of Satan, So he's a fan of Satan. Jews, he believes, are going to hell. He says, you can't be saved by being a Jew. Islam is a religion that promotes pedophilia, sex with children, just in case they didn't know what pedophilia was. And in a statement sure to please the Israelis, he has compared the treatment of Christians in the US to the Nazis' treatment of Jews right before they launched the Final Solution program to exterminate them. Although, in his defense, Oliver North also compared the treatment by Parkland students of NRA leadership in that exact same fashion.
Idea that you have to prepare and take care of everybody.
But Congressman, are you saying the society should just let him die?
No.